Hello, I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we are talking with Dr. Joel Waddell. He is an infectious disease specialist at Blank Children's Hospital, and we're going to be talking about the COVID-19 vaccine that is now available for children under 5 years old. So if you're a parent and have been waiting for this vaccine to be ready for your kids, I'm sure you are excited about it, but you might have some questions too. So Dr. Waddell is just going to share some information, and we'll start with just, why do you think it's important for parents to have their children at this age vaccinated?
Yeah, that's a great question. And as a parent of two kids in this age group, I have been anxiously awaiting this myself. But like you said, a lot of parents have numerous questions about vaccinating their kids under 5. Because throughout the pandemic we've kind of heard that, well, children aren't as severely affected as adults. But I mean, that's true. So young children aren't as severely affected as often as adults, but we do see children who require hospitalization. Unfortunately, we see children who pass away from COVID who are under 5. And so it's definitely something that we take very seriously. And we've seen many children hospitalized here at Blank Children's Hospital with COVID. And so if we don't compare, I've always kind of thought it's kind of an odd approach to compare COVID in kids to COVID in adults, because we don't do that with anything else. We don't say, well, more adults die of leukemia, so we don't really care about childhood leukemia. And so I think a better way to frame the choice for parents is to say, well, how do we compare the severity of COVID in kids under 5 to other things that we already vaccinate our kids for? Sure. Chickenpox, rotavirus, pneumonia, meningitis. And the thing is, COVID causes more hospitalizations in kids under 5 than several of these vaccines that we're already giving, several of the vaccine preventable diseases. And unfortunately, it causes more deaths in this age group than several vaccine preventable diseases. So it causes more deaths than rotavirus, chickenpox, type of meningitis, hepatitis A. So things you don't even think about. And so that's a pretty serious thing. And it's gotten so bad that in children under 5 years of age, COVID is now a top 5 cause of death in the United States.
Wow.
So if there's anything we can do to prevent these severe diseases, these deaths, we should definitely take it. And the great news is these studies showed very high levels of antibodies in kids under 5, and that's what you need to prevent hospitalizations and deaths.
Okay. Now, I think another question, on a parent's mind when they are introducing a vaccine to their child is, okay, so you're hoping to prevent them from getting COVID, but are there risks or side effects involved? And how do you weigh that, especially since this is a newer vaccine?
Yep, absolutely. Yeah, we got to weigh the risks and the benefits. And these studies had thousands of children under 5. And the good news is we saw the same side effects we saw in adolescents or adults. So a lot of kids had a sore arm or a sore leg. Some had fever, were irritable for a day or so, just kind of felt crummy for maybe 24 hours. And these were all transient. They all went away. There's been some things in the news about something called myocarditis. We didn't see any of that. It's a condition called that is heart inflammation. We didn't see any of that in these kids. And so the side effects are pretty similar to what you would have experienced as an adult. And that's when I got my 2 kids vaccinated, it was just like all the other vaccines. I mean, they cried, they didn't like it, and then they bounced back.
Sure. No, that's good information. I think another common question parents have is, well, my child already had COVID, so do they already have the antibodies they need? Maybe they don't need the vaccine. How would you respond to that?
No, that's a great question. And I want to go back real quick to the last one. I forgot something that's on a lot of parents' minds about side effects. And you kind of alluded to it a little bit of, it's a newer vaccine. And a lot of parents have said to me, well, I want to see we don't know what the long-term potential side effects could be. And that's a fair question. But two points to that. And the first one is when the vaccine is given, it is rapidly removed from the body. So nothing hangs around the body from the vaccine. And the other good news is there's no real scientific reason to think a side effect would only occur months or years or decades later. And in fact, there has never been a licensed vaccine where we've only seen side effects years or decades later.
Okay.
So the side effects we're seeing are the side effects that are there.
Sure. No, I think that's great information. Thank you.
Yeah, sorry about forgot from the previous question, but to address your other question, um, if your child has had COVID and they're under 5, like a lot of our kids have,
Right.
there's still potential benefit from being vaccinated because the vaccine produces a more robust immune response.
Okay.
And it's a way to remind the immune system what the virus looks like, and to prevent you from getting severe disease in the future.
Okay. So, the vaccine is available now. When do you recommend that parents get it? Is there any, is it summer right now and people aren't as prone to getting sick? Or, is there any use in waiting till the fall? Or do you recommend, just going ahead and doing it right away?
Yeah, that's a great question. So I would recommend that any kid under 5 go ahead and get the vaccine now, 6 months to 5 years of age. And the reason for that is because the Pfizer vaccine is a 3-dose series, and the Moderna is a 2-dose in this age group. And you don't really get protection against the current COVID strains until maybe 2 to 4 weeks after your last dose.
Okay.
And
Yeah.
so when you're thinking about it, you're not really going to get protection for at least a couple of months.
Mm-hmm.
And so if you want protection in the fall and the winter, kind of now's the time to act.
Okay, that's great to know. And where can children be vaccinated, or what does a parent need to do to make it happen?
So many pediatric and family medicine clinics throughout the central Iowa are now offering it right there in your clinic. And so the first step could be call your child's primary care provider and schedule an appointment. The other option is you can go to vaccines.gov, and it's an easy to follow thing where you can actually schedule most of your appointments online at pharmacies, IV, CVS, etc., right there from your laptop. So those are 2 easy ways to get it taken care of in about 2 minutes.
Okay, great. Well, thank you so much. I think, I learned some things about the vaccine today, and hopefully it is helpful for parents as well. Do you have anything else that you want to add, or just, let parents know about COVID and the vaccine for kids?
The only other thing I would add would be, if there's questions that still remain, you can just schedule an appointment with your child's primary care provider just to discuss this very topic. That way you're getting your information from someone you know and trust.
Yeah.
And I know I don't know most of the people who are listening to this, but I would never recommend something that I wouldn't do myself with my own children. And I feel very comfortable getting my children both under 5, giving them both this vaccine.
Great. Well, thank you so much, Dr. Waddell. We really appreciate your time.
You're very welcome. Thanks for doing this.
Yeah.